Hi, I'm Simone Maybin. I'm a doctor that works in CMC Orthopaedics, and I'm here to talk about complex regional pain syndrome today. So, complex regional pain syndrome is an unfortunate pain condition where people have an injury that cause pain in a limb. Typically, it's in your arm or your leg, typically one-sided, and it can come from having a nerve injury or from not having a nerve injury. So, there's two different types. One of the ways that we diagnose complex regional pain syndrome is from the clinical story or from talking to the patient and seeing what the story is, and then also asking about the symptoms and how they feel. So one thing that really separates this from different pain conditions is the pain is out of proportion of what makes sense for the story. So you stubbed your toe or you twisted your ankle, and now your pain is 10 out of 10 and you feel like your arm or your leg are going to rip off because it just hurts so bad. That doesn't make sense for the type of injury you had. The other thing that has to exist is some type of symptom that falls in the complex regional pain syndrome category. So either lots of burning pain or pain that feels abnormal when you do a light touch. There can be changes to the skin. There can be changes to swelling, the color of the area. There's a lot of criteria that are very similar between patients, and there's some things that are a little bit different, but it's very consistent that there's something that looks different and feels different in the limb. It's not just pain. Pain would make it not be in the criteria of complex regional pain syndrome. If complex regional pain syndrome goes for a very long time, there's other changes that happen that we monitor over the next weeks to months to years if unfortunately it's gone on that long. Now, what can we do to treat it? First, we're always going to start with physical therapy and medications to see if that is effective, but very quickly, because of time being important, we would start with doing a procedure called a sympathetic block, which we do under an x-ray and with a special needle and typically with a little bit of anesthesia so that it's comfortable for you. When we do that procedure, we were able to determine immediately if the temperature change in the limb goes back to normal. So typically I would take off my gloves right away and I'll touch the limb and I'll be able to compare to the other limb and I'll see if the temperature change has happened quickly. And that tells me my sympathetic block was perfect, along with the imaging that we used, of course. And the next thing we would do is we'd consider if we should do an ablation of the sympathetic chain. The sympathetic chain is kind of a web of nerves that are causing this pain to be abnormal. So it's not a typical nerve that shoots down the arm or the leg. It's a pain that is abnormally functioning in the sympathetic area. And what we were trying to do is correct that sympathetic response. So when you do an ablation of that area that is at a low temperature, it doesn't damage those nerves, but it can help to calm them down and to improve the pain dramatically. Another thing that can be helpful if those things don't work are doing medications and a pump into the area of the spine. That has been found to be helpful in very few cases. So it's not the first thing that we do. What typically we do if the injections have failed is go to spinal cord stimulation, which is inserting wires into the spine and leaving a battery operated device into the spine that would stay on continuously to control that pain 24 hours a day.